Good evening and welcome to Your Health Matters, our OC Holiday Edition. I'm Dr. Almaz Sheikh, Orange County Healthcare Agency's newest Deputy Health Officer. And I'm here co-hosting with Dr. Regina Chinsia Kwong, better known as Dr. CK, who we've all gotten to know over the years. The holidays are a time of joy and festivities, and they're already upon us. Our hearts and our homes are filled and being filled with beautiful memories. But they can also be times of stress and distraction. Today, our Your Health Matters topic is about how to prevent injury during the time of the holidays. Whether it's a fall, whether it's a car collision, whether it's something that happens to our child, we'll talk about a few different issues and see how we can make our holidays safe. So let's get started and learn how to keep our holiday joy levels at a high and your risk of visiting a trauma center at a low. I'd like to introduce our two guests for today. Dr. Michael Lekawa, Professor and Chief of Trauma at the University of California, Irvine School of Medicine, and Jennifer Gonzalez, Director of Trauma Services at Orange Global Medical Center. I'm going to hand it over to Dr. CK, who will take it from here.
Good evening, everyone. So I'm here to give you the update for RSV as well as COVID. Our COVID case rates have increased, unfortunately. We now have a rate of 14.5 per 100,000, and our case positivity has risen up to 13%. We have also seen an increase in hospitalizations and now have at least 388 in the hospital with COVID, and as well as 48 in the ICU. And the majority of the people who are requiring hospitalization or ICU admission for COVID still remain those who are not fully vaccinated or have not received a bivalent vaccine. So it's really important, especially for those who are higher risk, which is the elderly or the older population, to really get that updated bivalent vaccine. Additionally, there's other last week, the FDA and the CDC actually increased the eligibility for the mRNA vaccines to include those who are 6 months and above. So if you have a child who's 6 months and has started their Pfizer vaccine, if they have already received their second dose and it's been 2 months, they can actually receive the third vaccine as a bivalent vaccine. If they received Moderna and completed the 2-dose series, 2 months after their last dose, they can actually receive the updated Moderna bivalent vaccine. And here's a chart of the updated recommendations. We still have a very low vaccination rate amongst those who are eligible, so really encourage you all to get vaccinated and also to get your flu vaccine to reduce your risk of getting severe illness from either COVID or influenza. RSV rates still continue to be very high in the county and are still affecting a lot of pediatric patients. So again, it's still important to wear a mask, to also stay home if you're sick, to get your updated vaccines, and to also practice good hand hygiene by washing your hands. If you do have a cough and it's not COVID or flu or other viruses, wear a mask or cough into your elbow instead of your hands so you don't spread more germs. That's many different ways. There's, again, many different ways we can protect ourselves during this holiday season. We want you to really enjoy the time with your friends and family, but again, safely. Additionally, for those who are high risk, you want to make sure you have a COVID plan, COVID-19 plan. Understand that if you do get sick, there are more widely available treatments. So those who are age 12 and up, as long as you're 88 pounds or more and have a condition that puts you at higher risk, you may actually be eligible for an oral medication called Paxlovid. For those who are older, age 50 and older, even if you do not have any other chronic conditions, you actually are eligible for Paxlovid. So please seek advice from a healthcare practitioner to consider getting treatment immediately once you do get COVID-19. And again, get your rest, stay home when you're still sick with COVID, and continue all those preventive measures. I know there's a lot of gatherings during the holidays, so it's also important to know that if you are recently in a gathering and potentially exposed, monitor for your symptoms. If you do develop symptoms, please test. That's all I have.
Thank you, Dr. CK. We appreciate the update. And, you know, the holidays are in full swing, and we really just want to take this time to keep people safe and help them to understand how they can really enjoy their holidays the best that they possibly can. So thank you so much, Dr. CK. You know, many injuries and deaths that happen around this time, really, they're preventable. And what that means is that they really shouldn't have happened, or that we can do things to prevent them from happening. And that's things like falls, things like motor vehicle collisions, things like injuries that might happen to kids. But first, and before we even approach any of those, let's talk about trauma centers. We have two experts here from our local trauma centers, and I really kind of want to hear from them. What is a trauma center? What makes it different than, say, an emergency department? So, Dr. Lekua, help us to understand. What is a trauma center? Why is it different than the emergency departments that are so readily available in many of our cities in Orange County?
That is a great question, and it's a common area of misunderstanding. So there are requirements to be an emergency department. We call it paramedic receiving centers. So, and for in Orange County, for instance, we have 25, I think, paramedic receiving centers. And that's where you go when you need to get care emergently. However, if you reach a certain level of injury, then you want to be able to go somewhere where they have the resources immediately available to help take care of you. And so there's a lot of requirements. And for one, the Orange County EMS system oversees, along with using the American College of Surgeons, oversees the standards to make sure that certain hospitals have been identified that can deliver that care. This concept did not exist prior to 1981. The great news for Orange County is that we were, in fact, the very first county in the country to develop an inclusive trauma system, meaning that everybody is part of it. So no matter where you're injured, you will get taken to a place that has proven they have the resources. As an example, if you're in a terrible car crash in front of a non-trauma hospital, and you look like and you meet criteria, you will not go into that emergency department. An ambulance will know where to take you to a trauma center. That trauma center will have everything it needs in the emergency department to treat you immediately. Blood, emergency medicine physicians with trauma training, on-call trauma surgeons, and all the specialty people that you need. But you also need to have an operating room open and available. Sitting empty, it's very expensive. You need to have anesthesiologists waiting around for that trauma to come in, specialty radiologists, et cetera. So there are so many resources that are necessary to be able to take care of you in what we call the golden hour. It's an old term, but what it means is what happens in that first hour is critical to how you're going to do a day, a week, or a year later. So that's in short, that's the difference between a trauma center. It has all the additional resources.
So it sounds like it's a tremendous commitment on the part of a hospital that wants to be a trauma center. Now, you're from UCI and you're from OC Global. That's two of our trauma centers. How many trauma centers are there, Jennifer, in Orange County? And does it matter if you're a kid or if you're an adult? Are you going to go to a particular trauma center, or how do they decide?
So we do have OC Global, UCI, we have Mission in South County, and then also Chalk is one of our pediatric centers. And then also Long Beach is kind of on the border of Orange County and LA, so they get patients from both counties. And it does matter if you're a pediatric or adult. If you are a pediatric patient, especially a trauma patient, we want to send you to a pediatric center. So that would be UCI, Chalk, or Mission. And they have specialty trauma surgeons and specialty surgeons and equipment that would be perfect for a pediatric patient.
Okay. So talk to me about what kind of injuries might happen around the holidays. You know, we hear a lot about falls. Is there something special about falls around the holidays that you all see that we can talk about? Jennifer, is there something particular that you see as related to falls, say, you know, maybe with our older population?
I think the biggest thing I think of with holidays and falls is ladders. A lot of people are putting up their Christmas lights. You do see some really elaborate houses these days with a lot of decorations on the roof and things like that. So that's probably the biggest thing that I could think of as far as ladder safety around the holidays.
Dr. Lekua, tips for our audience? You know, how do we prevent these falls from happening, and what do you typically see? It sounds like a trauma center. You're not just going to you're not going to see a patient who just fall and scrape their knee. You're going to see someone who's had a serious injury. So what have you seen, and what do you want to tell people to prevent those kind of injuries?
Well, you know, there's injuries and there's injuries. So you can fall and break your ankle, and you'll go to an emergency department, not necessarily a trauma center. And that's unfortunate, you know, for your, it could be a skiing injury. Those are, you know, but what we're here to talk about are people with significant injuries that are going to be life, limb-threatening or brain injury-threatening, right? So what's going to give you a brain injury? What's going to put you in a hospital for a long time? What's going to threaten your life and ability, to live a normal life? And those are going to be falls that, usually it's substantial falls off a ladder, as Jennifer said. Around the holidays, it's very unique, and it's very well prescribed. I mean, people fall off ladders for a number of reasons, but in December, it's about hanging Christmas lights, and it's about doing it, especially if you're intoxicated. That's a double. So very commonly, it'll be I'm done with work, I'm going to hang lights. So it's men more than women, because they tend to be the ones that hang the lights. And they'll drink and fall. And the ones that seem to do the worst are going to be our older Orange County residents. So every year we see people die hanging Christmas lights, and it's just so tragic because it's so they could have made a different choice. They could have done it differently. Commonly associated with alcohol, even low levels of alcohol. So it's not common that people have 8 drinks and hang lights. They'll usually have 1 or 2, but that's still, And then being older, you're more likely to not have great balance as much as you may have had 20 years earlier. Your reflexes will be slower to be able to deflect the injury and all, and then your ability to tolerate the injury is worse. And so, I mean, every year, cervical spine injuries with paralysis or death especially from middle and older age Americans. So my tips are, if you're going to hang lights, hang them low around the house, and don't necessarily go for the roof. Consider hiring professionals. And don't drink if you're going to hang the lights up, and think about your own health before you do it. How is your balance, and how able are you to do it, and consider having somebody younger do it or just letting it go.
And so, in addition to, we can obviously hire someone, or if that's something that can work, or really just hang them lower. Other fall hazards around the house, just, decorations that are on the grounds, items that are left behind, tripping and falling down the stairs. Are those also risks for people showing up at trauma centers, whether it's related to holidays or not?
Yeah, definitely. And I do think that all the holiday decorations, you have even Christmas tree lights on the tree. So you're going to have a lot more, and a lot of light up things, a lot of electrical things like that to keep in mind, and then also just holiday decorations in general can be definitely a hazard. So you always want to keep your space free of clutter, have your rooms well lit, skid-free socks and shoes and things like that.
So, trauma centers, we talk about different types of trauma centers, different levels of trauma centers. Is there a variation in all that, and will that change anything that happens as related to where a patient goes? Like, as I understand, UCI is a level 1 trauma center, and OC Global is a level 2 trauma center. Explain that to me. What does that mean?
That's a great question, actually. So there are up to 5 levels of trauma centers, level 1, 2, 3, or 5, 1, 2, 3, 4, or 5. Level 1s and level 2s are the only type that we have in Orange County, and that is a decision that was made, and each one of those hospitals has the ability to manage essentially anything. They're clinically meant to be the same. When people think of a level 1 versus a level 2, a level 1 has to have more depth. So you have more surgeons, you can handle a larger volume ultimately, but for an individual, it should be the same. It has to have education, residents, medical students. We have to be, training people. So we train 3 trauma critical care fellows every year. We have 30 surgical residents and medical students, et cetera. You also have to have certain requirements that are probably too detailed for this level, like reimplantation and microvascular and things. But clinically, a level 1 and a level 2 are meant to be the same. So for an individual, you can feel very confident that in Orange County, when you go to a trauma center, you're going to be able to get that highest level of care that you need. If you're in a more remote area, there's level 3s that don't quite have the neurosurgeons and all, but that doesn't apply to Orange County.
All right. And the level 2, I think Dr. Lekwa has explained it, but OC Global is a level 2 trauma center. Does that change anything for, the patient that might show up, whether it's a fall, whether it's, anyone who's been involved in a car collision? Does that change anything for what happens over there?
No, I think we're held to the same standards as far as equipment, surgeons, and availability to take care of any injured patient that comes through the doors.
Can I choose what trauma center I go to? If I'm in a car accident and I say, I live near OC Global, take me over there. It's going to be easier for my family to make their way out there to visit me. Is that something that I can make a choice for?
The answer actually is interesting. It depends. So the answer is, in general, if you don't say anything, you will be taken to the closest trauma center based on traffic patterns.
Okay.
Time is so important. My general recommendation is that you let the paramedics make that decision. Theoretically, you can ask to go to a different trauma center, and if that paramedic has the ability to do it without compromising their response in their area, they might choose to do that. I'm not a big fan of that because I think, in general, you want to let the experts make the best decision at that time. But I wouldn't recommend requesting to go to a hospital that is your own hospital but not a trauma center.
Got it. So going back to injuries and things that happen around the holidays, we talked about falls. We talked about how to prevent those, falls that come from holiday decorations and putting up lights and really tripping hazards. Let's move on to kids. What do you typically see as related to children around the time of the holidays? And I'd like to start this by just telling a quick story. A couple years ago, it was the holidays. It was Christmas morning, and I happened to be out on my driveway, rather ironically, in just flip-flops getting something. And I just saw a kid take off running down the street. And he was headed towards the end of the street where there was a lake and a street. And no parent, nobody else. And I looked at this and just thought that was a little bit odd. So I chased the kid in my flip-flops down the street. Took me a little bit, but I caught up to him as he ended up on the street with no other cars. That ended well. Now, I ended up finding his father, and as the story goes, the door got left open on Christmas morning and the child took off running. So there's a lot of distractions, and it's a time that's really just full of joy for children. But how do we keep them safe? What do you see in your trauma centers, and how do we keep them safe, Jennifer?
I do think your story highlights the distractions during the holidays, so it's not necessarily specific injuries that we see during the holidays that we don't see throughout the rest of the year, but auto versus pedestrians, that would be a child getting hit by a car. That's definitely one that we see. Falls with kids, falls from windows, trip and falls, kids climbing on things maybe they shouldn't climb on, especially being at holiday parties or events that maybe they haven't normally been to before, and just being excited and curious. Other things, just car accidents in general. A lot of times you're out a lot more during the holiday season. And then especially we've seen a huge increase with COVID is e-bikes, so electric bikes and electric scooters has really ramped up over the past couple of years. So really keeping kids safe with that, making sure that they have their helmets on, that they know rules of the road, that if they're out even dusk or nighttime, especially now because it gets light so early in the wintertime, that they're wearing bright clothes or have their reflectors on, and they just are having safe practices, especially when they're getting new bikes and scooters and gifts and stuff for the holidays. So it takes a little while to make sure that they know how to use it safely.
So there's a lot of excitement around the holidays, and we have to go to our quick break, but I'd like to come back around and talk about e-bikes a little bit more and really hear about UCI and sort of what you do as a pediatric trauma center in that space as well. So we'll go to our quick break, and we'll be right back.
Thank you.
Most of us wouldn't associate Christmas with lower back injuries, but about 52% of Christmas injuries are due to lifting heavy objects like trees, decorations, or bulky gifts. Always use proper lifting techniques. Do a two-person lift when you need to, and don't risk ruining the holidays with a back injury just to get that huge box of decorations out of the attic by yourself. Traffic accidents are often the most serious risk to our safety during the holidays. This time of year, drunk driving accounts for 38% of fatal crashes, and 52% of fatalities involve someone who's not wearing a seatbelt. When traveling over the river and through the woods, make sure you're prepared for the weather. Wear your seatbelt, don't drive distracted, and definitely don't drive impaired. Also, don't forget about pedestrian safety. Wrapping presents, broken ornaments, and difficult packaging result in about 43% of holiday lacerations. To avoid this, use the right cutting tool for the job. Make sure any broken ornaments are quickly cleaned up, and be very careful when cutting and trimming the tree. Which brings us to our next hazard, Christmas trees. Trees are difficult to maneuver, heavy, often fall on people and pets, and have a tendency to burn and frequently poke children in the eye with pine needles. Not only that, mold on the trees can cause severe allergies for some people. To stay safe, use 2 people to position the tree. Keep the tree 3 feet away from heat sources. Get the right size tree for your space, water the tree frequently, and get rid of it when it starts to lose needles. If you have a mold allergy, use a vinegar solution to keep your tree clean and mold-free.
Welcome back. I really want to continue talking a little bit about, children and the holidays and the liveliness and the distractions and how that can all really lead down the path to injury. So, Jennifer, we were talking about e-bikes before we went on to our break. And, e-bikes, scooters, whatever sort of movable device we're talking about. But I know e-bikes have been a big thing. So tell me a little bit more about what are you seeing when it comes to kids and e-bikes? What's showing up at your trauma center? And how do we help parents to understand why these devices can be so dangerous?
So I think the biggest thing with e-bikes compared to regular bikes is just they go so much faster, and kids get really excited, even adults get really excited that they're maybe using it as they wouldn't use a regular bike. They're going a lot further. They're doing a lot more dangerous things with it than they normally would. And also they're riding them in the street more like a car than they would as opposed to on the sidewalk like a regular bike. So those are all definitely things that we're seeing. Also with kids, I think a big thing is maybe they have the helmet, but it's either on their handlebars or not fitting properly. So that's definitely a big thing to kind of touch on with children. And then just touch on, different injuries. And we've been doing a lot as a trauma centers with our community education and outreach as far as e-bikes and just letting people know, hey, these are injuries that can happen, a lot of broken bones or bleeding in the brain or even solid organ injury, things like that, and just making parents aware, letting them educate their children, and as trauma centers really trying to help the community and the schools as well to really know the dangers that e-bikes can bring.
So we're not talking about just scraped knees or broken arms or, a bump or a bruise. We're talking about some fairly significant injuries. I mean, I heard you say head bleeds, and I heard you say, solid organ injury. That means like your liver gets injured, or your spleen could get injured. Those are some fairly serious injuries. And, Dr. Lekwa, I know UCI is a pediatric trauma center, so we're talking about liver injuries, spleen injuries, brain injuries in kids. UCI is a pediatric trauma center. How does UCI manage those? What do you do? What do you see? And again, what tips do you think we should really give to our audience about how they keep their kids safe?
Well, when it comes to kids, I think probably the most timely one for this year is the e-bike, e-scooter. And this appears to be the fundamental issue, which is they're going at motorcycle speeds. They're wearing no helmet or bicycle helmets. And so, the difference between a motorcycle accident and a car, it isn't that motorcyclists get more accidents, it's that they don't have a car around them, so they get more injured. Mm-hmm. Now you put someone on a bike, they're traveling at motorcycle speeds, but they're not wearing the clothing to protect themselves, so they end up with tremendous road rash burns that need operations. And they don't wear a helmet that's actually a motorcycle helmet, so they're actually more likely to have a brain injury. So my recommendations, one, are that you must train a child to be able to do it. Honestly, this applies to adults. Mm-hmm. Because adults will ride a bike and they're used to cruising around on a cruiser at 5-10 miles an hour, and they're suddenly going 25, which is a standard. For kids, I would consider always having them on a bike with a governor, speed governor at 12 miles an hour. At least it will limit it to some extent. And to be sure that they are practicing under supervision. It's very early on in their experience that they'll have the accident. It's just like a motorcyclist. The most common day to get in a motorcycle accident is the day you buy it, and it's the same thing on Christmas and the holidays. They get the bike and they're going to be in an accident that week.
I'm glad you bring this up, because my kids keep asking for an electric bike or an electric scooter, and the answer is no, because I know that there's increase in injury, and I know every time I go to work, I see kids who are on their bikes or on their scooters without a helmet. The helmet is, like you said, it's on their hand, or it's not even on them at all. So that is a significant risk. Now, the other thing, my son is actually a mountain biker, and one of the things that happened was, he took a break from mountain biking for a little bit, and then just wanted to go mountain biking at our local parks. And unfortunately, of course, we understood. We tried to tell him and his friends, be careful. It's been a while since you rode your bike. And I'm thinking, with the holidays, everybody gets to their bikes. They have the time off. They're excited to go do a lot of things. And I'm guessing this is also where injury happens. Unfortunately, his friend did get injured. But the good news in Orange County is that the response time was amazing. So immediately the friend was able to get the care they needed and was life flighted to one of our local trauma centers and was expeditiously seen. So I think if you can talk more about that and what has happened here in Orange County in terms of timeliness to respond.
Well, we have a very dense county, and from a distance standpoint, except for the mountain biking up in the San Antonio, the hills, very short transit times. Actually, the time it takes to get from a trauma occurrence to a trauma center is almost always under 20 minutes. And that's a lot to do with our paramedics. We don't even require a flight usually. It's at 98, 99% of our transports are all by ground transport. And we happened we've spread out the trauma centers quite nicely that you can get to a trauma center pretty quickly. The trauma centers have made a commitment to be open, so we are all the trauma centers are essentially never closed, so it works out very well for people to quickly get to care. We have imagine you have an in-house surgeon waiting, you have in-house nurses waiting, you have an anesthesiologist waiting, the OR waiting, a radiologist, the CAT scanners are running. Everything is just waiting for patients to arrive. So we call it controlled chaos because when it happens, what you see, it's a lot like the TV shows. There's a lot of action going on, but it's very planned and it's very prescribed.
So even though our hospitals are really impacted with the current respiratory surge, if someone does get injured at home and is taken to a local trauma center, they will get care because trauma centers must always be ready and available, correct?
Correct. Yes, and even if and falls are still becoming so common now, especially among the elderly, and during the holidays. I know we're off the kids discussion now, but yes, the trauma centers will always be open. If one needs to close transiently, the other ones are always open, and we work very cohesively to make sure that we never have more than one down, and that's very little time.
And with that, we'll take our next break, and we'll come back around and talk about motor vehicle collisions, particularly as related to intoxication. And I'd also like to touch upon burn injuries, and we can start to talk about those as well. So we'll go to our next break, and you guys can hear a few more holiday safety tips.
Slips, trips, and falls are especially likely during the holiday season due to extension cords, crowding, slippery sidewalks, floors, and of course, toys. Anyone who knows the pain of stepping on a Lego can attest to that. Make sure to keep your walkways clear of snow and ice, keep cords out of high traffic areas, and keep a separate play area for toys when it's possible. Decorating tends to come with its own special hazards, and the biggest one is falls from heights. Around 5,000 people fall while decorating each year, with 43% of those falls being from ladders. What's more, guys, you're about 40% more likely than women to be injured. To decorate safely, always use the right tool for the job, meaning ladders and step stools, not chairs or the arms of the sofa. Make sure to maintain 3 points of contact and don't risk your safety for Christmas lights. Which brings us to the next hazard. Christmas lights. Christmas lights result in a shocking number of injuries each year, about 715. To avoid shock, check Christmas lights for cracked sockets or frayed wires. Don't use damaged electrical cords, and only use outdoor lights outdoors and make sure that they're plugged into a GFCI. Never overload the circuit, or you may also struggle with our next category, flammables. The holiday season is the season of storing flammables in the home. It's also the season of lighting candles, having fires in the hearth, and cooking gone wrong. To stay safe, keep flammables and heat sources separate. Turn off Christmas lights and other decorations before leaving and before bed. And check to make sure your fire extinguishers are functional and easily accessible.
That is exactly why you want a high-quality fire extinguisher right in the kitchen.
Also, while you're up on that ladder decorating, make sure to check the batteries in the fire alarm and carbon monoxide detector while you're at it.
Welcome back. Thank you again for joining us this evening. You know, I want to continue the conversation, Jennifer and Dr. Lecca. Well, we really appreciate having you both here and your expertise and just how we can help our audience really understand how to keep their holidays safe. You know, we broke off at a time where we were talking about, you know, motor vehicle collisions, cars, kids, all of that. Let me just circle it back a little bit. You know, there's a lot of guests that visit your house, and there's a lot of kids running around the house, and can it happen that, you know, as people are backing out cars, they may just not see a child behind them? Have you seen things like that happen? And how do we help our families understand that just be aware of what's going on around you?
Well, that's a very specific injury that is related to the holidays, actually. So there's a lot of family visiting, a lot of people moving around, and parents, in particular moms, are so aware of their children at all times. You know, they get in the car and they're going to put it in reverse. They're always aware of where the children are. There's a very common mechanism where other people are visiting your house and your kids are running around, and they're not as aware, and so they back up and not aware that somebody's in the sidewalk behind you. The rear view cameras has been a nice change, and we're seeing some less of that. Mm-hmm. But to that point, which is you're aware of your house, but there's a lot of other people around now. Mm-hmm. So when it comes to cooking and such, you know, people are having their drinks, there's a lot of visitors, everybody's interacting, and the little kids are running around visiting. And so there tends to be a lot more scald injuries from water that is being boiled or from oil that's being used for cooking turkeys and the such. And so you end up with a lot more scalding and burn injuries for children around the holidays. That's pretty unique.
From a family medicine perspective, I've seen kids put a whole lot of things in their mouth during these events, right? Like they'll put the Christmas tree in the lights in their mouth, or ornaments, or other things that shouldn't be in their mouths. And so then you start worrying about electrocution or poisonings that may occur when they're not being monitored closely.
So it's that awareness, it's that sense of kind of knowing what's going on around you and really just taking a moment to pause and take account of your surroundings. Back to the cars. Car collisions, drunk driving, intoxicated driving. I mean, it's something we hear about all the time. I feel like maybe it's increased around the holidays. Is that the case? Or, you know, do you see more of them? Are they more, you know, are they worse? Are they more severe at the time? Tell me what goes on in your trauma center, Jennifer.
We've definitely seen an increase during our summer months and the holiday months. There's a lot more events going on, a lot more holidays, a lot more Christmas parties, places for people to go and have fun and drink. So it's definitely increased during that time.
But our cars are safer. I mean, we have seatbelts, we have airbags, so don't most people make it from these car collisions?
Well, no, car crashes are still our number one cause of trauma and mortality. So it's still, you're going fast, it's always dangerous. Something unique about the holidays when it comes to car crashes, day to day, there's, you know, so as Jennifer said, in the summer and in December, we see a rise in car crashes. What is unique about certain holidays, 4th of July, for instance, particularly in Christmas, is even though on Christmas Day, for instance, everything shuts down, so there's a lot less traffic, but the likelihood that someone's drinking that day is much higher. And so they're traveling to and from a Christmas party on the weekends beforehand, or they're traveling to and from family meetings where alcohol is involved. And so they're more likely to, so that seems to make up for the less traffic on that time as they have the increased amount of alcohol. So the actual volume in accidents go up. The obvious answer is consider, don't drink and drive. Of course, that's number 1 through 10. You don't drink and drive. Even driving under the influence, what you think is lightly under the influence, still significantly increases your risk of being in a car crash. And also, even if you're not, remember other people are. So in as much as possible, awareness that of other people around you. Don't give a little bit more space, because they may be under the influence and they may take longer to stop behind you. They may be driving into you without you. So you have to be more forgiving and more careful overall.
And there's a lot of opportunities for, there's Uber, there's, Lyft, there's all kinds of options that are out there. So, designate a driver, hire an Uber, get a Lyft, whatever it is. And then also, make sure you're not leaving a half glass of alcohol somewhere so the child can find it, taking it back to just being aware of your surroundings. Now, it sounds like the holidays are a really busy time at trauma centers. Things don't seem to slow down as they do kind of for the rest of the world. Is that what your experience is? Is that what you see in the trauma centers? And frankly, probably in the emergency departments, I'm going to guess things are probably fairly busy.
Well, what we find is, so people don't like to do elective medical work over the holidays. So fortunately, some space is made by that slowing down. But the respiratory infections increasing, whether it's RSV, COVID, et cetera, are skyrocketing right now compared to where they were a month ago. And that overwhelms our emergency department. And so based on that and the flu, of course, you end up having a very impacted emergency department. And trauma is up. It's up 10, 15, 20%. So you have increased volumes. And you have healthcare professionals who are getting sick with RSV and COVID and the flu. And then people are on vacations, and so it just ends up being a challenging time. So it's a great opportunity to not be in a trauma, is the truth. We're there for you. We have an incredible trauma system. There's no vacations in trauma. We cover everything, but it's still a challenging time. Very impacted.
So then what? I assume then that would mean if I'm a family member that's coming to look for someone who's been in a trauma, who's been taken to a hospital, what should I expect? Will it take a little bit longer for information to get to me? I want to know fairly quickly what's going on with my loved one. Are they injured? Are they dying? What's going on? What should I expect as I get to the hospital?
So, of course, our first thing that we want to do is take care of the patient. So that's always our first priority, take care of the patient as best as we can. And, of course, we also want to let the family know as best as we can as well. So when we're able to, we will definitely let the family know. We do have a lot of resources, other team members, social services that can kind of help find families. Another thing I always recommend that helps the trauma centers and hospitals in general find family is the medical ID on the phone. So it always, I think it's under settings and health, and then you can go to medical ID, but you can put the emergency contact in there. So that I've actually used that quite a few times to try to contact family for trauma patients that are too sick to be able to call, that we can always get emergency contact that way. So that always really helps. But we will definitely let the families know and the loved ones as soon as we are able to.
So it's possible that I could come to the waiting room and just wait and not really get information, and I shouldn't just assume something horrible is happening behind the doors, because you have the resources, you're doing what's necessary. It's just going to require me to wait. Okay. So we're going to go to our next break, and then from there we're going to, begin to close this out. We're going to start to talk about our final topic as we, close out holiday injuries, and there's so much more that we can really discuss and cover, but let's just talk briefly about mental health and what that sort of leads to and what you might see in the trauma world as we come back from our break. So we'll be right back.
Food is a big part of the holiday tradition, and you may not realize this, but a less well-known part of the American tradition is holiday food poisoning. Make sure food is prepared safely, refrigerated properly, and cooked thoroughly. and avoid storing it in that danger zone of 40 to 140 degrees where bacteria can grow rapidly. If you have severe allergies, remember to ask about ingredients before you eat. And lastly, when going through leftovers, remember, when in doubt, throw it out. Now, speaking of eating, what about drinking? The average American sees a 100% increase in their drinking habits between Thanksgiving and New Year's. Don't let holiday spirits ruin your holiday spirit. Avoid overindulging and the dreaded hangover by giving yourself a limit of how many drinks to have. Make sure you're staying hydrated with water, sip slowly, pace yourself, get a designated driver, and if you're at a party with kids, make sure you don't leave half-empty drinks unattended. Next, cold, COVID, and other illnesses. It's good to be back celebrating with friends and family this year. Let's make sure we don't accidentally include viruses on the guest list. Wear masks when needed, wash your hands often, social distance in public, and consider a pre-Christmas flu vaccine or booster. If you're interacting with those who are unvaccinated, the best way to protect them is to make sure that you are vaccinated. Also, rapid at-home tests can help to make sure we spread cheer, not viruses. And last but not least, shopping mishaps. Rounding out the list, we have shopping mishaps. With how busy Christmas shopping can be, we need to be aware everywhere from the parking lot to the checkout line. Remember, there's often no crowd control in place, but there are definitely crowds. Consider shopping during less crowded hours or shop online. Watch out for slips, trips, and falls. Be patient with inconveniences, and remember, be considerate of the challenges all retail employees are facing.
And we're back, and welcome back, everyone. You know, we're going to start to close out our evening, but just a couple more things to really quickly just touch upon. Around this time, the holidays aren't really always so merry for everybody. A lot of people are going through a lot right now, and many don't celebrate the holidays for a host of reasons. Maybe they're experiencing grief from a recent loss. Maybe they just have financial stressors or life stressors, or things are just challenging in so many different ways from them. We've covered, mental health and wellness in our last couple of episodes, and we've talked a little bit about this, but I really kind of want to bring it back around because it is just so important that we take care of our own mental health as much as we take care of our physical health. As related to depression, as related to self-harm injuries, what do you see in your trauma centers around this time? Are you seeing people come in with those kind of injuries? Is there a sense of despair that sometimes comes with some of your traumatic injuries?
Well, I will start off with the result of trauma as opposed to the cause of trauma. I think you're talking more about the cause of trauma, but it is overwhelming to manage an injury. I mean, the thing about traumas in general is if you knew 10 seconds before they were going to happen that they were going to happen, you could have stopped it for most of it. And so when it does happen for the entire family, it is a crushing event. So I would just add how important it is that you pay attention and you try to prevent what you can, at least the obvious things of what you can, so that there isn't some disaster that then affects everybody's mental health. So I know that's a little backwards from where I think you were coming from, but usually it's about awareness, usually it's about not drinking and driving overwhelmingly, and then making good decisions about all the things we talked about. When you're talking about mental health otherwise, I immediately, as a trauma surgeon, think about suicide. That's just what I don't know if that's the topic you were necessarily getting to.
Yes, but suicide and self-harm is the topic that I'm trying to approach, because we see depression around this time. We see a lot of sadness, a lot of grief, and a lot of hopelessness at times. Are your trauma centers seeing more self-harm victims? Are they seeing suicides at this time?
if you look at big data, it isn't necessarily a time for higher suicides, at least not successful. We don't see necessarily more people with a higher level of successful suicides. But that's complicated because that's when you look at the whole thing. And if you break it down, it may be that there's some people that are just less likely. But what you do see is more people who are depressed about the holiday, and thus suicide attempts related to the holiday. And that's something that we can improve on. I mean, if you think about it, this should be a season where suicide attempts and self-harm should be less. We're with family, we should be happier. And we don't see that necessarily. You don't see any significant decrease. So I would say being aware of your whole, it's a time of change. Kids are home from school, if they're away from college. Young adults, are very vulnerable to suicide attempts and to worrying about, or their mental health stressors that happen. And you want to be sure that you're aware of what your kids are going through. And frankly, you should be aware of what leads to successful suicide attempts, which, regardless of what you think, it is related to the presence of guns in the household. So you got to be sure that they're secured. And it often isn't people their own; it's that they know where it is, and everybody knows where it's hidden. It's on the shelf in the closet up top, and everybody thinks that their kids don't know where their guns are, and they do. This is not just a disease of children. It is, suicide is a very common disease of older men. To be honest with you, that's probably the most significant population who are successful and most likely to use handguns. So I just want people to think about that's just a reality. If you have a gun in the house, you're 10 to 100 times more likely that there'll be a suicide with a gun. You're much more likely to be successful if there's a gun used.
Jennifer, I think Dr. Lekula summed it up very well, but any other tips, any other suggestions as we begin to navigate sort of this time of the season when people are coming together and some may just not be feeling the holiday spirit?
I think just be cognizant of the people around you, just of depression, of warning signs of suicide and mental health. There's lots of resources out there, so just make sure that the family or friend, whoever you are, has the resources that they need to help them. And then also check in with yourself and your family members, making sure that you're doing the right things for you as well during this time.
And we spent the last couple of our episodes talking about mental health and wellness around, not just necessarily around the holiday season, but at many different times. And I want to give everyone the reference of the OC Navigator. You can look up the OC Navigator on our website, on the agency's website, and you can find resources as related to mental health. You can also find resources for just about anything else. For those of you who are experiencing homelessness, if cold shelters, if you're in need of food, all of those resources kind of come together on OC Navigator, which was just recently launched and has been of tremendous use across our county. So do take a look when you have a moment. I want to loop, Dr. CK, you into the conversation about something that I think maybe as a family practice physician, you've probably seen and in follow-up a little bit more than, say, any of us really have to deal with, because I think Dr. Lekula and Jennifer, as they've explained to us, the trauma centers, they see the worst of the worst injuries. Yeah. But let's talk about more minor things, just cuts. What we know in the medical world is lacerations. Right. Talk to us about those.
There's a lot of injuries. Not as traumatic injuries as you're seeing, but they're the minor cuts and bruises and injuries from falling, right? When you're opening up those presents, there's some sharp objects, or when you're putting up any decorations, right, there's sharp objects, and then also with the toys, right? All the new toys that are around, now they're all laying around the house, and so people get injured by stepping on them or falling and tripping over something. So you just have to be very mindful and careful. Tell your kids to take their time with opening gifts, and also clean up the clutter, because the clutter can actually cause more injury. And as I alluded to earlier before, kids tend to put a lot of things in their mouth, and so I typically saw a lot of injuries relating to people or kids actually putting ornaments in their mouth, or maybe putting a drink that shouldn't have been in their mouth, right? That maybe someone left unattended. So there's other foods and things in their surrounding that they can actually get into and get injured with. One of my most memorable seasons was when a younger child, a toddler in the household, in a busy household with a lot of different visitors, came up and looked at me with her mouth was all blue, face was blue, but luckily she was happy and smiling. And what happened was she was playing with the Christmas lights. So we were worried, oh my goodness, did she get a little bit electrocuted, but she's still speaking to us? Or, did she ingest something? We didn't know what it was until we finally found it was actually a Christmas ornament. But these things happen. So actually, we didn't talk about burns, but I'm sure that on the trauma world, you see burns also as it relates to like minor, well, not minor, but electrocutions with all these different electrical devices as well as the lights.
Or just dry Christmas trees that are put near flames. Tell us about burn injuries. Are burn injuries something that you commonly are seeing in your trauma centers? Do trauma centers handle burn injuries, or do they go somewhere else?
Well, in Orange County, all the burns go to only to trauma centers, and so the big, so the classic one that's considered is being very careful about tree fires, and when there's a tree fire, it burns exceedingly fast, and it's usually very catastrophic. So a tree that gets on fire usually becomes a house fire, and it's pretty dramatic. Some of the lesser burns that you might think about are going to be scald injuries. I say lesser, it's a lot for the, but it's scald injuries, either from kids not being washed as closely. There's a lot of cooking, and like I said, a lot of oil-related fires, and then the electrocution ones from the plugs. All this electrical cords connecting cord to cord to cord, and kids are touching them, and all of that. So there's the minor ones, which would be the little hand burns, finger burns from the electrocutions. There's not a lot of major electrocution burns for kids that put them in a burn center that commonly. For the holidays, scalding, cooking injuries mostly.
Okay. Well, really want to thank you all for coming in and talking to us about the trauma centers and what resources we have here in Orange County and how to protect ourselves during the holidays and prevent, hopefully, from getting injured during the holiday season. We want everybody to really enjoy their holidays, but that means not getting yourself into injuries that can get you in the hospital, and also protecting yourself again against all the viruses that are circulating, getting yourself vaccinated with flu vaccine as well as a COVID bivalent vaccine, wearing your mask, practicing good hand hygiene, and also being more aware about people around you and how they're doing. Because this time of season, we want it to be merry, but it's not always the case. And so there are many people in our households and in our communities who are suffering at this time. So please check in with your loved ones and your neighbors to make sure they're doing okay. I know today also, actually this week it's been really cold. The weather's been really cold. So also check in with those who are at higher risk, like the older population. So again, really want to thank you for joining us this evening and learning more about preventing traumas. And I see that we also have our OC Links phone number for those of you who want to look into more behavioral health resources. You can also look at OC Navigator for resources. And really, again, want to thank you all.
Happy holidays, everyone. We'll be back in January. I think we switch over to a once a month at that time. And so we will be back, and I believe Dr. Chow will be back at that time too. So you will see Dr. Chow and his original the original host for Your Health Matters, Dr. Lekala. Jennifer, thank you again for taking time out of your schedules, particularly since the holidays I know are a busy time, but we certainly appreciate your expertise and the knowledge you've provided our guests.
Thank you.
Thank you very much. Bye.
Thank you.